Hi everybody, this is Bukhara State University online lessons. I'm Bahron Mamatlup Ahmedovna and today our topic is COVID-19. So today we'll learn about new vocabulary of this infectious disease. So what do you think, what's hidden there? What do you know about COVID, coronavirus? So we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. So this citation was taken from Dr. Tedros Adhanom, World Health Organization's Director General. So let's look at the word itself, how the name COVID-19 originated. So COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or simple coronavirus. Before the outbreak originated in Wuhan, China on December 2019, there was no information about this virus. So the name COVID-19 is the acronym for the word coronavirus in December 19. So let's look at the history of this disease. So it's not first pandemic in the world. So the oldest common ancestor of coronavirus has been dated as far back as the 9th century BC. Some studies published in 1990 specified the most recent common ancestors as follows. So beta coronavirus, delta coronavirus, gamma coronavirus, and alpha coronavirus. And so the last centuries we can see, so in 1720, Great Plague of Marseille, and so cholera pandemic after 100 years, and then after a century we can see flu, and so in 2020 we can see coronavirus pandemic. So now let's talk about coronavirus itself. What are some activities you heard about that people are doing in quarantine right now? Why are some people panic buying things? What products are people buying a lot? What's social distancing? How important do you think right now? So let's learn some words related to coronavirus. Let's check how many of the words related to coronavirus can you find here. So you can search these words up, down, cross. Could you find? Okay. So soap, tissue, coronavirus, fever, immune system, clean, mask, spread, wash, cough, healthy, COVID, infection, prevention, symptoms, water, hygiene, isolation. So now how these words are related to COVID-19. So do you know the symptoms of this disease? So this is coughing. So you have fever and headache. So you feel tired and you can have chills. Aches, and you can have difficulty in breathing and sweats as well. So these are symptoms of coronavirus. If you have these symptoms, it means you should maybe you should have this virus. So safe environment to protect you. What you should do in order to prevent this virus. So first of all, you should know about COVID-19. And you should wear properly your masks. So for all patients and employees in your workplace, in your schools, university, everywhere, in public places. So, and deep cleaning and enhanced sanitation. Patient, employee, physician, temperature screening. So before entering some public places, employees, physicians, and patients, so all people should be checked their temperature. So social distancing, so you should keep social distance. Wait in your car or outside for your visit. So this can save you to prevent infectious disease COVID-19. So now let's complete this worksheet. So some buildings and places might be closed to help prevent coronavirus from spreading. We should stay at home to stay safe. It's important to use soap water to wash our hands for about 20 seconds, or we can use hand sanitizers to wash away germs. Also, try not to touch your eyes. So, and nose with unwashed hands. So if you follow these rules, you will be safe. So now let's talk about individual presentations. So this time you have to share your experience, what you experienced during quarantine time and how this time affected you and your family. And you'll be given 5 minutes to prepare. So if you are ready, raise your hands. So, and there are some recommendations in order to help you. So, not sharing antibiotics with others, because every individuals, they have their own immune systems. That's why you shouldn't share antibiotics with others. And so like the ones caused by viruses like colds and flu. So the symptoms of this disease are similar with flu. So if you always follow the advice of professionals, you can reduce the spread of antibiotics resistance. You can help antibiotic. Not all infections can be treated with antibiotics. You can reduce the risk of infection by cleaning your hands. So germs can cause bacteria to become resistant. You can reduce the risk of infection by vaccination, right? So water and soap or sanitizers. So you should properly wash your hands. And you shouldn't overuse of antibiotics. And keeping your vaccinations up to date. So now there are some tips of staying resilient amidst COVID-19. So first of all, limit your time on social media. Second one, reduce overall consumption of media, particularly cable news. If in need of information, take out reliable and trustworthy sources. So next recommendation is focus on what you can control. Prioritize self-care. Find ways to remain connected. Brainstorm and set activity goals. So now let's watch some pros and cons of coronavirus. Let's debate. So are there any advantages and disadvantages of this disease? What do you think? Did you like quarantine time? Or are there any negative sides of sitting at home, not going to the work, and not to get education in traditional way? So let's see some positives of pandemic. So universities and schools are shutting down, which means that stressed out students can have a break and they can just have a rest and sit at home and learn distantly. So second positive is travel is being suspended, which means so carbon emissions are going down. And next pros is festivals, concerts, events are being postponed or canceled. So as we said before, there are some rules. So avoid close contact with people who are sick and avoid touching your eyes and nose with unwashed hands. So every time clean your hands with sanitizers and wash your hands when you come from outside, and better to stay home. So now your task is how COVID-19 affected my life. So you have to write your reflection, how coronavirus changed my daily routine. Write at least 150 words. Then we will talk about it next lesson. So goodbye for now and thank you for your attention.